Bismillahirrahmanirrahim. We are discussing MRI of the lumbosacral spine. The patient is 78 years old. He presents with a history of low back pain, and here we see abnormal marrow signals are noted under superior end plates of upper four lumbar vertebrae, and we can also see that there is reduction in the heights of these vertebrae, especially through central portion of their bodies. Here we can see marrow changes on sagittal T2 weighted sequences as well. There is mild bulge of posterior body line, especially of L3 vertebra. Here we can also see that pre and paravertebral spaces shows normal fat planes, and we can also see that end plates are not eroded, rather they are compressed by previous trauma. Similarly, marrow along inferior end plates are normal. So because of presence of normal inferior end plates and normal marrow in lower half of vertebral bodies, possibility of metastatic disease or infection is ruled out. So we can say that these all upper four vertebrae shows osteoporotic compression fractures. Similarly, we see that all discs are preserved and there is no abnormal pathological tissue in these discs. So this rules out infective component in the spine as well. We can see posterior osseous elements, that is spinous processes on sagittal T1 and T2 weighted sequences, which are normal. Similarly, sacrum shows normal marrow signals, so possibility of metastatic disease is also ruled out. So in this case, we have ruled out metastatic disease. Number one, we have ruled out multi-level infection, and we have concluded that changes in upper four lumbar vertebrae are because of old osteoporotic compression fractures. Overall, multi-level degenerative changes are also appreciated at all disc levels. Minimal degenerative narrowing of exiting neural foramens are noted at L2-3, L3-4 and L4-5 levels. Conus and adjacent lower dorsal cord is unremarkable. Here we can see axial T1 weighted and axial T2 weighted sequence. We can see bony canal is capacious in spite of degenerative changes and in spite of compression fractures, and we can also see that there is reduction in the bulk of paraspinal muscles, especially posterior paraspinal muscles with fatty infiltration. So in this case, we have seen that there are multiple vertebral osteoporotic compression fractures. We can assess bone mineral density through DEXA examination, and we have ruled out multifocal infections, and we have ruled out metastatic disease. Thank you very much. Assalamu alaikum warahmatullah.